Hi, my name is Nathalie Koos and I'm a research professor at the University of Antwerp in Belgium. And the main goal of our research is to use cells to treat patients with autoimmune disease. Now, these patients with autoimmunity such as multiple sclerosis, rheumatoid arthritis or type 1 disease, diabetes, they have hyperactive immune responses to harmless self-antigens, and our hypothesis therefore is that if we can present these self-antigens in the context of tolerance-inducing or regulatory antigen-presenting cells, we can re-educate the immune system to down-modulate these hyperactive immune responses. So for that, we have generated in the lab dendritic cells of patients with multiple sclerosis and loaded them with myelin-derived antigens, which is the self-antigen in the MS patients where the hyperactive immune response is directed against. We created these dendritic cells to become tolerogenic by treating them with vitamin D3, which is the active form of vitamin D. And these are characterized, or these cells are characterized by so-called maturation-resistant phenotype. And even more importantly, they induce T-cell hyperresponsiveness against the myelin-derived or the self-antigens in the MS patients. Now, based on these observations and in collaboration with a Spanish group which is led by Professor Eva Martinez Caceres, who demonstrated the efficacy of these tolerance-inducing dendritic cells in EAE, which is the mouse model for MS, we are now preparing all paperwork and validation experiments to start a clinical trial in patients with MS. So hopefully when everything goes right, we will inject the first patient beginning 2016. So where do I believe the future of cell therapy is in 5 or 10 years? I think more and more results point out that every patient is unique, and based on that fact, personalized treatment strategies will become more and more important, in which I think cell therapy will take a very important place.